session if that's okay. Yeah. And this is just for your own ease so that when you have free time and when you want to work on your assignment, for instance, you have access to whatever has been taught. I hope you can see my screen. I'll just turn off my camera so that you can focus more on my screen. Is my screen visible to all of you?
Yes.
Yeah. I'll just enlarge it. So we're talking about social issues in healthcare, and we're basically talking about health and social care provision. So I'll talk you through what is expected from you. So when you're doing your assignment, so the last day, when we have our last session, so there are four learning objectives. So the last learning objective, when that is completed, there is a session that I will take with you that is regarding your assignment. So that is another session. This is just a brief overview of what you should expect from this unit. And this will also support you in your assignment also. So in that you now know where to focus on basically. So the first learning outcome is to understand how health and social care provision are measured. So how do you measure health, or how do you measure social care provision? So there are different definitions of health. And according to that, there's no one exact. So initially it was said that health is the absence of disease, but not now, not anymore. So the World Health Organization has a very comprehensive and an extensive, I won't call it an extensive, but more, it's not as short as just having no ill health or having no disease. So health has changed. The measurement of health has changed. And so has social care provision changed. The definitions have changed. The concepts have changed. And then we would want you to understand the roles of health and social care practitioners. So you as social care practitioner, what can you be doing? What are your roles? What are your expected roles? And then the third learning outcome would be to understand inequalities. So we've talked about health, but what are the inequalities in health and social determinants? So we know that health is determined through, it's just not, as I said, it's just not disease that determines health. It's a lot more. It's a lot more societal that determines your actual health. And then to understand the implications of ethical and legal issues within health and social care. Is that clear to everyone?
Yeah.
Yeah. Any questions, please raise your hands or just let me know in between. So now I'll break down each learning outcome. So when we're talking about the first learning outcome, for instance, it's to understand how health and or social care provision are measured. So in this, we would discuss the importance of data in health and social care provision. So why is data important? Any idea? Can anyone comment on this? Why is data important? Or what is the importance of data in health and social care planning actually? Anyone?
I think it helps in the evaluation of study, to know that sometimes the number of people that you're going to count on with your research or the study that you are going to do.
Yes, exactly. Thank you, Portia. Anyone else? Okay, that's fine. So yeah, definitely. So for planning, you would want to know what is happening actually. I don't know. I was sharing this slide. It's gone away. I'll share it again. That's okay. So, so obviously for whenever you're planning something, you would want to have previous data regarding it. If that's not there, obviously, you don't know where to start and you don't know where to go next. So whenever we talk about data, it is important in everything. Like if you're planning, let's say we're planning just a meetup, let's say, as small as this thing. We need to know, we need to have data of what is available there. We need to know who eats what sort of stuff. We need to know who has the conveyance for that place. So there's this data actually helps you in planning for everything actually. And when it comes to crucial stuff like health and social care planning, that is even more important. And then we would want to explain the influence of demography on service planning and delivery. Does anyone know what is meant by this term, demography?
Graphy? I don't know. I don't remember.
Okay, what is graphy? What do you mean by graph or graphy? Like telegraphy, photography?
Yeah. Is it not something to do with illustration of record?
Yes. So it's a bit, you can call it as a study, and demos means people. It's a Latin, I think it's a Latin or Greek word. I'm not sure, I'll have to check that out. But demos means people and graphy means the study. So it's the study of people. So with demography, you have changing demographics like ages. People used to live for shorter periods early, and now they're living for more longer periods, and they're living so people are living up to the age of 90s, and some have crossed their hundreds also. So initially we in the middle age, we didn't have this before, like maybe 20 years or 30 years or maybe a decade before, we didn't have these dynamics. But earlier, many 100 years ago, this was the same that was happening, like people who lived for a longer period of time. So you would want to explain the influence. So when you're trying to understand how health or social care provision is measured, you would want to explain the influence of demography on service planning and delivery. And then just make it large again. The next is to understand the roles of health and social care practitioners. So as you are the health and social care practitioners, you're working within the organizations, we would want to further on explain the roles and responsibilities. This is a part of your assignment also, but within these learning objectives, we will talk about the roles and responsibilities of health and social care professions. What do they do? What are their roles? How do they have training? You would want to identify key features of effective partnership working, because there's so many multiple agencies working together. So how do you develop effective partnerships within them? And then you would want to understand inequalities in health and social determinants. This is the last learning objective that we were talking about. Is it the last one? No, it's the second last one. Sorry. So inequalities. So inequalities exist everywhere, but they're being more prominent in health and social determinants. So we would want to discuss the influence, what influences health. So there's several determinants of health, but what are the influences of health? The main influences of health. Then we would want to explain how inequalities of opportunity can impact on health and well-being of an individual. So we've said, yeah, there are inequalities, but how does that impact your well-being or your health? And then the last learning outcome was to understand the implications of ethical and legal issues within health and social care. So we would want to discuss key ethical and legal issues on health and or social care. You should always know this because we are working in the organization. you definitely have to be aware of what works and what doesn't work. And then the last bit is to explain the role of professional codes of practice within a health and social care setting. We'll talk about all the regulations and whatever is important for you to know. Any questions on this bit?
No.
Okay. Yeah, that's clear. So that's good. Now I will proceed towards my presentation. Just give me a moment. So this presentation, I'll keep it very interactive so that you know what, so even when you're going through the session later on, I won't go beyond 11 o'clock because I'm aware of, obviously, you have limitations. I also have them, and it's a 1 hour session. So we'll definitely break it up into 2 parts, if that's okay. I'm sharing my screen, and just let me know once you see it. I hope that's visible to everyone.
No, I
Yeah?
still have my problem. I still cannot see. I have to get
Josephine,
it
it's
sorted
okay,
out.
but I hope it's visible to the others. Okay. Can everyone see my screen?
Yes, I can see it.
Okay, thank you. Thank you for that. Okay, so health and social care provision. Our first learning outcome was to understand how we measure health and social care provision, and how does it inform our services. So the indicative content, we always talk about what is the content that you'll be working around. What would we be talking about within this session? So we'll talk about health related data. So there's several data that we use for health. And the studies are called epidemiology. So it's changing patterns that, as I said, they're patterns that are changing regarding mortality, infant mortality, and morbidity. So morbidity is disease, and mortality is obviously dying of the disease. So the patterns that have been changed regarding mortality and morbidity. So what are those patterns? We'll be measuring, and we'll talk about how do we measure them. Infant mortality. Do you think infant mortality is risen or has it decreased? Any idea? I'm talking globally.
I think so. With the present health improvement, I think so. Oh, I don't know.
Any idea? It could be right or wrong.
In a way.
Has infant mortality been reduced or increased? If it has been increased, why? And if it has reduced, why and where?
That I don't know.
You don't know? So we're talking about inequalities, right? So
Yeah.
inequalities exist everywhere. They've been there forever, but they've been more highlighted now. In minority, obviously, in the NHS we see. So for whatever reasons, there were several determinants for that. But when we see infant mortality and morbidity, it has drastically risen in those who are more deprived compared to those who are not deprived. I'm talking about social deprivation. I'm talking about deprivation in terms of education, or whatever you say. So all the statistics have been not favorable for those who are marginalized, who are in considered a minority group. So that's the dilemma. So that is how the patterns of mortality and morbidity have changed. People are living longer, but when they live longer, they have a lot more to deal with, a lot of more diseases that they're having to deal with. So you see people having hypertension, you have diabetes like never ever before. That is because the people are living to a longer year. They're living more. And when they live more, their duration of those diseases, their chances of having those diseases increases. Then we'll talk about social care related data. So we have birth and death rates. We have data relating to mental health and mental capacity. We have adult social care outcomes framework, children's social care statistics. What is the importance of demography? I talked about it earlier. So it's changes in population size. So your ages, children are dying more, but there are people who are living to a longer years, and they're those people mostly who are not socially marginalized or socially deprived. We'll talk about demography deals with race, ethnicity. So it's a study on people. Demography means a study on people. So we're studying people's race, ethnicity, regional differences, and distribution of population. We're talking about trends. So there could be trends for diseases, trends for, let's say, blood pressure, trends for hypertension, etc. How demographic data is linked to planning, making predictions, resourcing, and staffing services. The common statistical terms that we use normally are means, median, mode, percentages, and rates. Reading and interpretation of health and social care related statistics, uses and abuses of statistics. Okay. So we talked about epidemiology a bit. So what is epidemiology? Epi means, it's again a study about how diseases spread. And it is again, it comes from not, if you remember epidemics. So the diseases that we talk about, and we talk about how they spread and how do they affect populations. And you would identify patterns, causes, and risk factors. So why do we do this? Obviously, we need this data because we have different diseases impacting. And situations like COVID can happen anytime again, God forbid. But when we have the data earlier. So what happened before COVID? Any epidemic that you can recall that happened before COVID? Any time that you could remember in the history of human life? Any other epidemic that you can recall?
Measles in children.
Yes. Does anyone remember plague? Has anyone heard of plague? The epidemic of plague? The rat disease? Yes. We know about SARS. We know about SARS, that sudden acute respiratory distress. So that was an epidemic. And there were several other epidemics that have been there. So an epidemic is something that becomes uncontrollable. So when you have data, like if we have data of several epidemics that have happened before, and how did people deal with them? So if there's a respiratory cause, and if you think that it spreads through respiratory tracts, you then follow spacing, you follow isolation, you follow rigid SOPs. So that worked before, and that data actually helped this time with COVID-19 as well. So this data is therefore so important. This involves, so epidemiology basically involves the collection, it's the analysis and interpretation of data related to the occurrence and distribution of health and disease in human populations. So epidemiologists use various methods. Why do they use them? This is to investigate the factors which would contribute. So what are the factors? For instance, Portia, do you have a question? Okay, that's okay. So how do these diseases spread? How do these So you have different data, like you get data from observational studies. There's several randomized controlled trials, systematic reviews. These are different study designs that tell you how do these diseases spread.
Yeah.
From years and years now, there's several diseases that were spread and that were documented, and those documents are now helping us in preventing other diseases. It's not just COVID-19, it's a lot more that is under control now.
Yeah, that's
Yeah.
true.
Okay. Also, there's certain deadly viruses. They're still obviously, they're still in laboratories. They've been controlled in laboratories, but if they go out of control, obviously there is such deadly viruses that can kill in an instant, even deadlier than COVID-19. So people use statistical methods to analyze data and to evaluate the effectiveness of public health interventions. So we use public health, these SOPs were public health interventions, which public health specialists took years and years to determine that this is the best way to prevent or control the spread of diseases. So you might have rotavirus, for instance, or you might have measles, measles is spread through respiratory droplets, but rotavirus, for instance, is spread through fecal. It's fecal-oral contamination, fecal-oral spread. So your fecal matter would get in contact with your hands, for instance, and you're using the same hands. So that's another. So there are different ways, different diseases are spread, different viruses are spread. So you have all that data, and that data comes from epidemiology. So these studies, they inform public health policies and programs and to improve health outcomes of populations. And they're very important. We talked about mortality. So mortality will refer to the number of deaths. So morbidity is the number of diseases. So if there's a morbidity happening, how many people die out of it? So that's mortality. So in a given population, what is the number of deaths during a specific time period? So it's not going to be from the beginning to the end. No, it's just like for 1 month, how many deaths occurred. It's up to you what time period you select, but you want to see how many deaths occurred, let's say from 2019 to 2021, let's say for COVID-19. So that's mortality. So it's often expressed as a rate. So that's the number of deaths in a population divided by the total population. So if you want to see the whole world's, the global population, you would divide it with the global population, and on your numerator, you will have the number of deaths in the whole globe, which is very hard to determine actually. So some people might have died of COVID-19 and you might not have the data. That's another thing. But the data will help you in understanding what is the mortality rate. And why do we determine mortality? Why do we want to know about mortality rate?
Is it not to prepare better for?
Yeah, to plan. So when we have different ages, sex, other factors also that we can use to break down mortality data. So what does it help in? It helps in measuring public health. It's an important measure of public health. It helps to track the effectiveness. So what interventions worked? As I said earlier, there have been several outbreaks of disease, epidemics of disease. So what helped before? So you might have used vaccines, you might have used screening programs, you might have used public health campaigns. What was the best way to preserve life? So that is why. What is infant mortality? Infants are, sorry. An infant is a child of 1 year of age. Beyond that, that child doesn't remain an infant. So till the 1st year of age, the child is called an infant. And infant mortality, again, is the number of deaths of babies within the 1st year of life. Infant mortality is again expressed as a rate, which is the number of deaths of infants under 1 year of age per 1,000 live births. So it's an important indicator Sorry. So my session will end in 10 minutes. So yeah, so I'll continue next tomorrow with the same session. So infant mortality is an important indicator of health and well-being of a population. It is closely linked to the quality of maternal and child health care, social and economic conditions, and environmental factors. So there's several factors that impact infant mortality. Some of the leading causes worldwide are complications because of prematurity, low birth weight, birth defects, infections, and sudden infant death syndrome. So the infant dies because of being suffocated mostly. And it's very, very common in infants because they're not mobile enough to move a pillow, for instance, move a blanket that has been covered. So we have different ways of reducing them. So reducing infant mortality is a priority for public health programs and policies. It is a key measure of overall health of a population and effectiveness of healthcare interventions and policies aimed at improving maternal and child health. So, then we talk about morbidity. This will be my last slide. Any questions before we end this? No? Okay, so morbidity refers, as I said, to the prevalence or incidence. So what is prevalence and what is incidence? Any idea? Does anyone know what is meant by prevalence and what is meant by incidence? What do I mean by prevalence and what do I mean by incidence? So incidence is new cases of a disease and prevalence is new and old cases of diseases. So for instance, you won't say that what is
Sorry, please. Can you repeat yourself, please?
Sorry?
Can you repeat yourself, please?
I didn't get you, sorry.
Can you come again, please? The prevalence and
Okay,
incidence.
sorry. Yeah. So incidence is new cases of a disease. So for instance, I'm at a university, I'm working there, and I want to see incident cases of injuries, let's say, in a particular department. I want to see how many new cases of injuries do I have from, let's say, the 1st of August. So I want to see new cases. But if I want to see prevalent cases, I won't say how many new cases are there of injuries from the 1st of August. No, prevalent cases are those that have been there for some time. So once the incidence happens, it becomes a prevalence again. So new cases always become a part of the old cases. So if there's a case today, tomorrow it will become an old case, and then there might be a new case next. So every new case is called an incidence, and prevalence is prevalence is old and new cases. So you have old cases, and then there are several more cases that have been added. So for instance, from if I see there might be very less incidence of COVID-19 now. But if I see it in 2020, there were many new cases of COVID-19. But if I want to see how many cases happened from 2019 to 2021, I will see prevalent cases. So what was the prevalence of COVID-19 during these years? Then I'm seeing old as well as new cases. So prevalence means old and new cases, while incidence is all new cases. You want to know how rapidly it's happening, how many more people are being affected because of it. That is why you want to see incidence. How common is it? So morbidity is often measured as a number of cases of a particular disease or condition per unit of population, and it's expressed again as mortality. We express it as a rate. Again, it tells you trends, it tells you patterns, and how to evaluate the public health intervention. So you might be wanting to intervene into a disease process by adding a vaccine. How did that help? How did that reduce morbidity? Did that increase morbidity? So morbidity rates again can be calculated as for mortality for different age groups, gender, or other characteristics of the population. There are several factors that contribute to morbidity. These include genetics. So if there's a disease running in your family, you will have a predisposition of having that disease. That disease is going to last for longer time in your family, and your ancestors might have had a disease that would then prevail in your offsprings as well. Environmental, so the environment, different environments have different predisposing factors. Behavioral, so your behavior also predisposes you to certain illnesses. A person who exercises will be reduced, will have reduced illness compared to a person who lives a sedentary lifestyle. We know that. And other social determinants of health. We'll talk about this later. Public health programs and policies aimed at reducing the morbidity rate often focus on prevention, early detection. So you want to detect cases earlier. Why do we want to detect cases earlier?
For prevention.
Sorry?
For to detect cases earlier is to prevent.
Yes, exactly. That's what
catastrophe.
prevention. Yeah. Yeah. Thank you, Josephine. So we are not curing diseases. If you cure a disease, for instance, if there's someone who has, let's say they have genetics working in their family, and their genetics show that they're more predisposed to having diabetes. So you want to prevent those people from developing diabetes instead of curing them of diabetes once they've developed it, because that's going to have lifelong implications on themselves, but also on the NHS. So you would not want to spend so much all their life for diabetes. And with diabetes, you have lots more of going on in terms of diseases. So you would want to prevent rather than cure. Curing is, you don't have an option. You would want to cure. Obviously, you have no other choice, but you would always want to prevent a disease before first. Sorry. And public health programs and policies aimed at reducing morbidity rates often focus on prevention, early detection. So if you're detecting cancers earlier through any means, you're actually preventing cancers, breast cancers from happening. Sorry. Treatment of diseases and conditions, as well as promoting healthy behaviors and addressing social determinants of health. So with that, I conclude my session. As you're hearing, I'm losing my breath also. Any questions up till now?
No, I'm okay.
Okay. The reason why I'm going slow and steady is that because I want you to win the race. Yes. So that is what my aim is, that you go. I just want you to focus on what has been taught, because there's a lot to take right now. It's the unit specifications, what the unit entails, that has been talked about. And we've talked about mortality rates. Tomorrow we'll talk a bit more and focus a bit more on the first learning objective. If everything is clear, is everyone happy with the session? And the recordings will be available to you on Monday on Moodle.
Okay.
Okay. So you all have a good time, and I'll see you tomorrow then.
You.
Yeah.
Thank
Thank
you.
you.
Thank you.
Bye.
Take care. Bye.
Bye.